So cradle cap is a common form of a rash in dermatology that's called seborrheic dermatitis. And seborrheic dermatitis can occur at different ages of life. When it occurs in babies, we call it cradle cap. And it's very, very common. A lot of babies will have a little bit of cradle cap during the first few months of life. It tends to spontaneously resolve. It doesn't tend to need treatment, but coconut oil can be considered to try to manage it if that's desired. Sometimes early cradle cap can be a sign that a little baby might be more likely to have eczema. So that's something to look out for if your baby has cradle cap. It might be an early sign of eczema. You can also see seborrheic dermatitis in different age groups. So we see a lot of seborrheic dermatitis in patients who are preteen and teenage kids. This can happen for a couple different reasons. In the childhood age population, sometimes it happens because the child has now taken responsibility for their shampooing themselves, and they are not doing it well. And the mechanical action of shampooing really helps prevent seborrheic dermatitis. So when I see an 8-year-old or a 9-year-old with seborrheic dermatitis, I often just encourage good shampooing technique. Kids get older, we sometimes see seborrheic dermatitis on the scalp of girls who have long hair, who either go to bed with wet hair or put their hair in a bun on the top of their head while it's wet. That dampness close to the scalp will contribute to some seborrheic dermatitis. So those are relatively easy things to fix. If it's shampooing technique or if you're just going to bed with your hair too wet, you can fix that and make your seborrheic dermatitis go right away. We also have a wonderful new treatment for seborrheic dermatitis that's a topical, non-steroid treatment approved for patients age 9 and up. It's once a day and it's a foam, so it's like a mousse, really easy to use. It's called roflumilast, the brand name is Zoryve, and we're very thrilled to have this lovely treatment option to treat patients age 9 and up with bad seborrheic dermatitis. Cradle cap is not harmful and it typically causes no symptoms. We don't see pain associated with cradle cap and we don't tend to see itch associated with cradle cap. In fact, if I have a baby who has a rash on their head that looks like cradle cap, but they're really itchy, I think, I bet it's eczema. Cradle cap in babies will go away on its own. In fact, if it persists, we think of it as eczema. The general rule of thumb is if a cradle cap-like rash persists past the age of 6 months, we call it eczema at that point in time. Cradle cap in babies tends to occur early on in babyhood and then it just spontaneously gets better. Most of these babies will not have recurrences of it. However, if they did have recurrences of it, I would wonder about eczema, in fact. So seborrheic dermatitis can affect the scalp most commonly, but can affect other areas too. This is particularly in older patient populations, adults and elderly patients. They will sometimes get seborrheic dermatitis in their eyebrows, in their facial hair, sometimes on the chest. And so you can sometimes see seborrheic dermatitis in other places besides the scalp, but that tends to be more common in the adult patient population. We don't recommend picking the scales from cradle cap because it can disrupt the hair follicles, and we don't want to do that, especially in a little baby. If you did want to do something about your baby's cradle cap, a good solution is some coconut oil applied at bedtime and then gently combed through in the morning.